What's going on, guys? Tony Maritato, Sunday morning. I want to spend a couple minutes with you talking about words, right? Words are super important. Words are really powerful, and especially when we talk about the words we choose in marketing. So marketing is just about communication. Marketing is not sales. I feel like as a physical therapist, I am an expert problem solver. Patient comes to me with a problem. I develop a solution. I develop a plan to get to that solution. I, at the end of the day, am a problem solver. And when I'm working outside the scope of third-party payer systems, I have the most freedom to solve those problems because I can provide anything within my plan of care as long as the patient is willing to pay for it. So that being said, I'm assuming you, like me, are expert problem solvers. And I want you to think about the words you choose, because for many of you who are just starting in private practice, mobile therapy, brick and mortar clinic, you have a problem. Your problem is communication. It's getting your prospective clients to understand what you do, the value in what you do, and how you deliver it. So when I look at so many websites, so many marketing campaigns, so much Facebook advertising, all I see is expert physical therapy, one-on-one care. Like let's take one-on-one care for just a second. I know you appreciate one-on-one care. I know you think it's important, believe it's important, and you want the patient to care about one-on-one care. But what problem is the words around one-on-one care actually solving? One-on-one care is not solving the problem of pain, dysfunction, limitation. One-on-one care doesn't help me throw a football or climb a rock wall. One-on-one solves the problem of loneliness. Now, if you're selling a solution to loneliness, absolutely sell one-on-one. If I was, and I'm speaking out the back end of my body here, if I was a psychiatrist, psychologist, and I'm connecting a counselor, and I'm connecting with individuals that need my undivided attention, they're not really paying me for the solution, they're paying for my attention. That's the problem one-on-one solves. I, as a prospective client, do not want one-on-one. I don't want to pay for one-on-one. I don't believe I need one-on-one. I want you to educate me. I want you to develop the solution to my problem. Give me that solution and let me go implement that solution on my own. So depending on your market, depending on your ideal clientele, one-on-one is not always the word choice to solve your problem. Now, we want truth in marketing, right? McDonald's, the franchise, calls those little brown discs hamburgers. You probably don't call it a hamburger. I certainly wouldn't call it a hamburger, but they call it a hamburger because that word choice has power with their audience, right? I worked in skilled nursing for a very short time. I can remember the undergarments that patients, clients were wearing. I would never call them an adult diaper. Depends, the brand doesn't call them an adult diaper. I know some people do, but the word choice is powerful. So I want you to think about the word choices. I want you to look through your copy. Think of kind of keywords. Forget SEO for a second. Just think of the keywords you guys are focusing on in what you're trying to sell and the message you're trying to communicate. Pull the keywords out. Ask yourself, what is the problem this keyword is solving? I believe one-on-one is solving the problem of loneliness, not necessarily the problem of pain, dysfunction, other stuff. And maybe you believe that solving loneliness will solve pain. Totally fine. There's huge evidence to support that kind of connection. I'm not against it. But if you're looking to target a more active adult population, if you're looking to help people with maybe chronic conditions who want to be more physically fit, I would challenge the fact that they really care about one-on-one, that they really care about professional designations. You know, oftentimes, and I'll wrap up with this, oftentimes, so I was a strength coach, personal trainer before I became a physical therapist. I held a relatively low level of esteem within a client's eyes until they heard that I used to be a personal trainer. And then instantly they would light up. They would be so excited to work with me. They couldn't believe that they had a personal trainer who was working with them, because now I have this higher perceive the value in terms of fitness and exercise and performance and all the things that they wanted, they didn't want to perceive themselves as being weak and injured and frail. That's what commonly is associated with physical therapy, right? But strength coach, performance trainer, success coach, motivational speaker, like these are terms that in our world, we're like, the fake guru is, you know, what we think of. But in reality, in the consumer's mind, that's what they're looking for. So give them what they're looking for, but provide them what they need. Common phrase we always use. Anyway, guys, I'm gonna go back in. It's family time. I hope this content was valuable. If it was, like the video so I know you want me to produce more like this. Subscribe to the channel if you haven't, and post your comments on YouTube so we can increase the engagement for the video and help the YouTube algorithm find more content. Thank you guys so much. I'll catch you next time.